Alright, okay, so hello dears. Ayan, so hello and welcome again to the third video now on our lecture on viral hepatitis serology. And for this lecture, we're going now to discuss the main dude, the star of Pasko, yes na talaga. And I think one of the most important good, the hepatitis viruses, and that is your hepatitis B. Because again, hepatitis B is common, no? It's blood-borne, yes, it can be transmitted through blood. And it could be of harm to us as medtechs when we work in the laboratory. Okay, so it's really important that we discuss this. Okay, alright. And so again, hepatitis B infection is caused by your hepatitis B virus, HBV. The complete virion, the complete infectious virion is also known as your Dane particle. Please take note, it's also known as your Dane particle. Okay, so it's enveloped DNA virus, double-stranded. That is, of course, part of the family Hepa DNA Viridae family. Ayan, diba? So, same with Picorna Viridae. I pronounced it before as Hepadna Viridae. So now, because again of Sir Jamu, so I pronounce it as Hepa DNA. So, I already know that, okay, it's a DNA virus, niya Hepa pag yun. So, Hepa DNA Viridae family. Hepa DNA Viridae family. So, as you can see, it's the only DNA virus of the hepatitis viruses, primary hepatitis viruses. The rest of your hepatitis viruses are usually RNA virus. So, siya lang DNA. So, very nagjudaan, DNA virus. So, dali na lang kaya niya ma-infect ang human cells. Kay DNA na yun siya mismo. So, paspas na niya ma-inject ang genetic material sa cells. So, paspas na po niya ang pag-replicate in a way. Diba? So, ayan. So, Hepa DNA Viridae family enveloped. Okay. Alright. Replication occurs in the cytoplasm of the hepatocyte, similar with your hepatitis A. And you have 8 distinct genotypes or genotypes, A to H, with different clinical outcomes. So, if your doctor really wants to be more specific to determine the genotype, then pwede niya na i-request, but in high-end laboratories na din, mga research labs or reference labs. Okay, but most of the time, hepatitis B, bisag wala na yung genotype, okay na, it would suffice. Okay, alright, ayan. So that's for the etiology. Now for the epidemiology, it's also known as your serum hepatitis or long incubation hepatitis. Ayan, so opposite siya with your hepatitis A. Serum hepatitis is because of its mode of transmission through blood, no, through mga sexual pagyud, parenteral, and even vertical death. Okay, so that's why it's also a serum hepatitis. And long incubation, because again, I think the number of days niya for incubation is much longer compared to your hepatitis A. Okay, alright, ayan. So it's a major cause again of morbidity and mortality throughout the world as a blood-borne pathogen. Ayan. So it's a blood-borne pathogen and it's transmitted, of course, through the parenteral route, intimate contact with HBV, ayan, contaminated blood or other body fluids, via the perinatal route, so sa baby, sa papanganak ba, or as mother to fetus, or via sexual contact. So you could get the virus from a lot of sources. So body fluids, example of body fluids, kung asa siya pwedeng makuha, you have of course semen, vaginal secretions, ayan, diba? So, very good ang sexual. And lastly, pwede po siya makuha through saliva. Ayan. So, therefore, ayan. So, punta ta sa blood bank. Blood bank, yes. Okay. So, if you are a donor and you are living with a person having hepatitis B infection, pilay mo deferral. Okay. You are a person, you are about to donate blood, but you are living with a person who is HBV positive or who has hepatitis B infection. Kung sa deferral ana, it's 1 year. Basta close contact or even sexual contact with a person na HBV positive, that's a 1 year deferral. Okay? 1 year deferral. Close contact. Ano man na ay deferral? It's because possible of saliva. Close contact man. Okay? So you're living with a person. Close contact. So it could be that sa pag-share yung utensils, no, saliva, or sa pag-talk ninyo, so dako dyan chance na na-transmit ang saliva nimo. Okay? So pwede ka ma-infect po. So that's why you have a 1 year deferral. Okay? But, let's say, okay, close contact, or you are living with a person with HIV. Ayan. HIV, unsa may deferral ana. Close contact lang, no sexual intercourse, whatever. Close contact lang, you are really living with a person that is living with HIV. So, you are No, wala na. No deferral. Okay? Because, take note that your HIV cannot be transmitted through saliva as long as may blood ang saliva, di ba? So therefore, if you're just living with a person na may HIV, wala man mo sexual intercourse or wala mo yung mga sexual relations or blood whatever exposure ba, then you are not deferred, no deferral. But if you are already having sexual relations, sexual contact with HIV, then that is now a permanent deferral, di ba? Permanent deferral. Okay? It's important. Permanent deferral lang yun if you have sexual intercourse, sexual contact with HIV. Because again, primary mode of transmission sa HIV, sexual transmission, di ba? Sexual intercourse, di ba? Okay, alright. So, deferrals, yes, blood bank, lumalabas sa boards. Usually, they refer to DOH ng mga deferrals. So, that's why I told your lab teachers na, si Ma'am Lera ito, sa blood bank, to focus more on the deferrals sa DOH. Kasi mo nang mugawas usually sa board exams. Sa ako board exam. Ang nigawa sa ako ang deferral kay a patient received a plasma product, a dengue patient na transfusion siya o plasma product, pila ka years or unsay ang deferral, and according to DOH that is 1 year. Basta kadawat kag plasma product or blood products. 1 year you have deferral. Okay, and sa'yo ko, nalimot ka because I hate blood bank. Joke lang. Okay, alright. And so, muna siya, deferrals, very important yun to be a master of this. Okay, lumalabas sa boards. Alright, ayan. So, those are the epidemiology of hepatitis B. And again, very, very common in the Philippines. Nako, hepatitis B, very common in the Philippines talaga. So it's really important that we talk about this. And you as medtechs, di ba, as I've chika ninyo sa HIV na serology natin, I had experience of needle prick injury. So very, very important that your titers, your anti-HBs, mga antibodies are high para jud makaprotect ninyo. Okay? Alright, ayan. And you may be thinking, sir, ano siyang hepatitis B? It's because, di ba, again, if I'm not mistaken, siya ang first hepatitis virus na na-discover. If I'm not mistaken. Okay, that's why it's called hepatitis B because ang naka-discover niya is si Dr. Baruch Blumberg. Ayan, di ba? Blumberg. So as you can see, letter B. That's why hepatitis B. Siya naka-discover sa hepatitis B virus. Dr. Baruch Blumberg. Okay. Alright, ayan. So mga history lang. Okay, alright. So that's for epidemiology. Now we go into the signs and symptoms. As you can see, incubation period niya is really long, 45 to 90 days, diba? So muna siyang long incubation compared to your hepatitis A na about 28 days lang, diba? Alright. Symptoms that vary among different age groups, okay? 90% of newborns are asymptomatic. 5 to 15% of children can have acute hepatitis, and 33 to 50% of your older children, adolescents, and adults can have acute hepatitis. Okay. Alright. And development of chronic HBV infection in which the virus persists in greater than 6 months is independently related to age, meaning anyone can have a chronic infection of hepatitis B as long as the virus exists or persists in your body for more than 6 months. Ayan, so it can progress to chronic forms. But more at risk ang mga immunosuppressed, immunocompromised na mga patients. Example, those having HIV, may mga defects sila immune system. So sila yun ang mas vulnerable, mas prone to developing chronic forms of hepatitis B earlier. Okay? Alright. Ayan. Okay, mga immunosuppressed, mga immunocompromised. Okay, alright. So that's for the signs and symptoms. Okay. Alright. Now, for chronic hepatitis B develops in about 10% of your infected adults, 25 to 50% of young children, and 80 to 90% of infants. So, mas prone yun ng infants because your infants' immune system are still developing. So, dili pa yun na strong yung immune system to fight off the virus. Okay? So, for adults, 10% na lang because again, our immune system is quite developed na. Okay? So, in a way, pwede pa natin siyang ma-eliminate. Okay? Pwede pa natin maka-fight back against the virus. Okay, alright. Ayan. Okay. Chronic infection, most likely again to develop, as I mentioned, who are immunosuppressed and those who have HIV. And HBV infected and most HBV infected adults recover within 6 months and develop immunity, but about 1%, bahalang 1% lang, that's still a great amount or a great number, they can develop fulminant liver disease, which can have high fatality rates. Okay. Now, the progression of your liver disease and HBV infection is fostered, again, as I mentioned, by the persistence of your HBV in the system of your patient and constant DNA replication. Okay. And this is manifested by the presence of your HBV DNA, okay, at a threshold of about 1,000 to 10,000 IU per ml. Ayan. So, if you want concentration of HBV DNA, if it is at this level, threshold niya, above this level there. Above this level, okay, 1,000 to 10,000, above that level, then, if sigigin ana, then your chances of progressing to a chronic form, a more severe form, is high. Okay? Alright. So, because persistent ang pag-replicate sa imuhang virus sa immune system. Okay? Alright. Ayan. So, that's for hepatitis B. Okay. Now, we go on to the viral structure of your hepatitis B virus. Konting virology na. Because it's in the viral structure that we see now the different serological markers, serological tests to diagnose your hepatitis B. Okay, so important viral proteins are your three. The envelope protein, which is known as your HBsAg, surface antigen. Structural nucleocapsid core protein, also known as your HBC antigen or your core antigen. And lastly, the soluble nucleocapsid protein, your HBe antigen or related antigen. So how do I remember? Kani sila duha kay para silang nucleocapsid na protein. So kung structural na letter C, so siya ang HBC, okay? And soluble na E, so siya ang HBe, okay? So mga mnemonics lang. Sana naman. If you don't want them, again, it's not required, okay? Tinutulungan ko lang kayo, okay? Alright. Ayan, okay. So those are the different mga viral proteins that we will look into and mga serological markers natin for HBV later. Okay, alright. Ayan, for manifestations, these proteins that are also the HBV antigens that we can see from a patient's sample infected with HBV, okay? So you have HBsAg, hepatitis B surface antigen, HBe related, HBe, diba, the soluble nucleocapsid protein, and hepatitis B core antigen or HBC antigen. And of course, if there are antigens, the body's response are your antibodies, so each of them have their own antibodies then. Okay. Now, for writing the ideas, especially if you're like writing lang, always take note that the letter B is capital to indicate that it's hepatitis B, okay? And then small letter, for example, structural, and then of course your antigen. That's why you write HBsAg this way. You don't write it this way, ha? Do not write it this way, the small letter B, okay? Because the letter B there stands for the virus, it's hepatitis B, okay? Then small letter S for structural, and then AG for antigen, okay? Or, so hopefully. So, capital siya ng HB, high blood, charot, pumba, charot. Okay, HB, and then small letter na if it's S, structural, C for core, A ba for related antigen. Okay? Alright, ayan, sige. Do not write it this way. Ha? Please. Okay. Alright. Now, we go on to the HBV antigen, starting first with the HBsAg. It's also known as the Australia antigen. Why is it called Australia antigen? It's because this antigen, the surface antigen of hepatitis B, was first isolated by Dr. Baruch Blumberg from the blood of an Australian aborigine. Ayan. So the first this antigen, HBsAg, was first isolated by Dr. Baruch Blumberg from a serum from the blood of an Australian aborigine. When you say aborigine, these are mga indigenous tribes, indigenous people who have been living for the longest years in Australia and even other countries. Pero so Australia usually aborigine na term, okay? So aborigine, okay? So that's why it's called Australia antigen. Again, because HBsAg was first isolated in the serum or in the blood of an Australian aborigine, okay? Alright, so this HBsAg is the earliest marker of infection. So siya ang first marker na ma-detect nato in the patient in the serum of a patient infected with HBV. And it also indicates active infection, the HBsAg, okay? Alright, please take note. So that's the first antigen. The next one is the HB-related antigen or HBe antigen. it's present during active replication, and because of that, it can be seen in active replication. It means that if this is found in the serum of the patient, it could indicate that the patient has a high degree of infectivity. Meaning, if ma-detect na siya, it means that the patient can really infect the others, okay, through her blood, through different body fluids and all that. Okay? Basta HB antigen, marker of high infectivity, high degree of infectivity. And lastly, your HBC antigen, it's not detectable in serum. It cannot be detected in serum. Okay? Their HBC antigen. Okay. So we then look into the structures of your HBV antigens. As you can see, again, this orange one, these are your HBsAg. Sa surface, not just a surface. Okay? Your HBe antigen, as you can see, is here. Mayroon siya, diba? So it can really pass through and it can go out of your serum. But for HBC antigen, this color blue one, diba, it's big, so it cannot go out because of the envelope sa imong virus. It cannot go out because of the envelope, okay? Matabunan siya, okay, or matrap siya. That's why hindi siya ma-detect ang sa serum ng HBC antigen. HBs antigen ra and HBe antigens. Sa antigens, mo rin ma-detect sa serum HBs, AG, and HBe antigen. So this here is a complete infectious virion with a nucleocapsid, with all the antigens. But your HBV, hepatitis B virus, can assume a lot of shapes. Pwede siyang elongated, okay, alright, and you have the spherical, so same shape here. Both of these shapes can assume or can have the HBsAg, but this is still considered an incomplete siya na virion. So therefore, these here, kung incomplete siya, na elongated or spherical, na incomplete, then these virions are non-infectious. So, dili sila makatakod. Hindi sila makakause of infection. Okay? So, these are the non-infectious forms of your hepatitis B. Okay? Ayan. And others also others may have a tail, napadyo-eco. So, di ba? Intense ang imong hepatitis B. Okay? But, nonetheless, your spherical, elongated, basta ano yung forms na walay sulod, they are not infectious. Okay? They are not complete na mga virions. They cannot infect an individual. Okay. Alright. So, here's an example, electron microscopy. Dane particles, you can see complete virion na ay sulod. Kapantay mo aning inner, that's the nucleocapsid, di ba? Whereas this one, spherical form, di ba, empty na siya. Wala siya sulod. Dili makita ning inner circle, which is your nucleocapsid. So this is non-infectious and as well as your elongated form, non-infectious. Okay, mara siyang bacteria na bacilli, di ba? But anyway, ayan. So electron microscopy ni siya. Okay, alright. Ayan. Now we go to the antibodies. Of course, the first antibody to be released is your antibodies to HBC or anti-HBC. The IgM is the first to appear, of course, and it indicates current or recent infection. It's usually used for detecting infection in cases of window period. Ayan. So the antibody or the test that you want to perform if the patient is in the window period is your IgM anti-HBC. Okay, kaya siya rin ma-detect. The rest of your markers, dili ma-detect. Okay? Alright. And for IgG, it indicates past infection and immunity and it provides lifelong protection and it can persist for a lifetime. IgG anti-HBC. Okay. And for anti-HBC also, we test again, same with anti-HAV, total anti-HBC. So when you say total anti-HBC, again, it combines your IgG and IgM. Okay. So it could be that pwedeng negative na yung IgM, pero positive yung mukhang total anti-HBC. It means that you have already the IgG anti-HBC. Because again, example, nagpa-test ka separately of IgM, nagpa-test ka IgM anti-HBC. And you also have a total anti-HBC. Ang result kay negative na ni pero positive. So it means that you already have the IgG anti-HBC. Okay, negative naman ka sa IgM pero positive ka sa total. Because again, a total, it combines IgG and IgM na concentration. So you're detecting both. But you cannot differentiate kung kinsa jud ang kung di ka differentiate kung kani siya na test lang mismo ang imong ipa-test niya positive ka, you cannot differentiate if it's IgG or IgM. Pero if kanina scenario nagpa-test naman kang IgM anti-HBC, yung negative pa yun, yung positive ka sa total anti-HBC, It means that negative ka sa IgM pero positive sa total, it means that you have the IgG na. Okay? I hope na-gets lang. Alright, okay. Ayan. Okay, now that's for the anti-HBC. Again, the first antibodies to be produced, ang anti-HBC. Next is your anti-HBe. It indicates convalescence and recovery. Okay? Alright. And for HBs, anti-HBs, of course, this is seen in recovery period of hepatitis B, and aside from that, it persists for years, providing again protective immunity. And this is what we look after po if we have vaccinations for hepatitis B. So ang mga vaccines, the ideas, so you have hepatitis A na siya vaccine, and hepatitis B, we have also a vaccine for that. Okay? Ang hepatitis C, I think wala pa yung vaccine, if I'm not mistaken. Okay, alright, and the rest of the hepatitis viruses. But A and B natin ay vaccines. That's why, as medtechs, very important that we are vaccinated with your hepatitis B and mga boosters natin. Because again, this is what we look after, your anti-HBs. Because again, it is produced after immunization with hepatitis B vaccine, and it can protect us. Okay, alright, protect us, especially during mga untoward accidents like mga needle stick injuries or exposure ba to contaminated whatever that may contain the hepatitis B virus. And protective titers for hepatitis B, anti-HBs, ang titer niya na protective is dapat greater than 10 IU per ml. Okay, so titers greater than equal 10 IU per ml. Okay, so muna siya protective titers for anti-HBs. Okay, so muna siya itong ginalook after, diba? So kana mga nagpa-titers mo, diba, for anti-HBs and HBsAg, diba? Ito check if HBsAg na ba kay current infection for hepatitis B or wala. And anti-HBs, if you have sufficient immunity ba, you have protective immunity to hepatitis B virus. That's why magpa-labs mo, diba? Sa inyong requirement siya if mag-phlegm na mo, diba? Because again, we want to make sure that you are well protected. So if gamay pa yung mga titer mo na magpa-booster mo. Okay, alright. Ayan. Okay. And anti-HBsDI is not produced, okay, take note, during chronic infections. So if you have already hepatitis B na chronic, negative yung anti-HBs, it's because your immunity fails to develop na. Okay, so you cannot produce any more antibodies because again, your immune system is overwhelmed, so hindi na kayo siya makaproduce of necessary antibodies. Okay, that's why negative ang anti-HBs to your chronic infections. Okay, alright. So those are your serologic markers. Okay, alright. Okay, alright. So we now look into this serological markers, parang timeline. Okay, serological profiles ng hepatitis B infection. Very important, Jude, as in that you know, malabas sa boards. Okay, alright. So of course, at the start of the infection, okay, so ang musugod yun, guys, is of course your HBsAg. Okay, because it's the first marker of infection. Okay. Tapos, sunod is of course your HBe antigen. Okay? Your HBe antigen will now, diba, indicates high degree of infectivity. So, siya ang sunod na marker na ma-appear. Okay? So, pag increase sa HBsAg, may-increase po o hina-hina imuha after mga short time, no? After HBsAg, may-increase mo na mga HBe antigen. Okay. Now, for HBs antigen, diba, pag decrease niya, musugod na po increase ay mukhang anti-HBs. Okay. But at the same time, pag decline na si mukhang HBsAg, decline pa lang siya, nag-start na increase mukhang anti-HBc. Diba? Because that's the first antibody to be released. Okay? The first antibody to be released. Okay? Not the marker, ha? Kung first marker to be released, that's HBsAg. But the first antibody to be released, di ba, is anti-HBc IgM. So, na-start na siya, di ba? Okay. And of course, since we are talking about anti-HBc total here, so it includes na IgG, bahalag mawala ng IgM diri, magpadayon na siya o plateau, meaning na immunity for long time, lifetime. It's because total naman siya, meaning it already has the IgG. Okay. Now, your anti-HBc IgM, this one, diba, it also increases, pero decrease po siya. Okay. Now, your anti-HBc IgM is your marker, diba, for window period. So, in this period na parang diridapita, na nag-decline at tanan yung mga antigens, as you can see, ang IgM ra na anti-HBc ang makita. Siya ang increase. So, therefore, siya ang ma-detect in the window period. Okay? Okay? And of course, pag decrease na sa HBsAg, produce na po ng anti-HBs. Okay? Alright? And your anti-HBc total, IgG, and anti-HBs will now protect you for a long time. Okay? For lifetime. That's your immunity na to hepatitis B. Okay? Alright. And then anti-HBe mo, of course, it will decline. And this antibody usually indicates convalescence or recovery, diba? Okay, so please take note. So, muna siya muhang serologic markers inuhang HBs, hepatitis B, HBs. Okay, alright, ayan. Now, here is some example of results, no, sa panel to interpret according to 3rd John. Okay, so for the first scenario, negative tanan, of course. So therefore, the patient is susceptible because again, negative siya tanan. Next, HBsAg is negative, anti-HBc is positive, and anti-HBs is positive. So this indicates immunity because of natural infection. Why? Because positive imong anti-HBc. Bahalag negative na imong HBsAg, it means that once you have anti-HBc na positive, it means that you underwent an infection. Kaya ma-produce naman ng anti-HBc if ma-infected yung ka sa virus, di ba? Kaya if unsa man nimo pagkabalo, unsa man pag-produce anti-HBc if wala ay virus, di ba? So therefore, if ni positive kag anti-HBc and then positive pa kag anti-HBs, bahalang wala na yung HBsAg, negative na, it could only mean that you were infected by the virus itself. Okay? That's why you are now immune because of natural infection. Okay? Whereas, comparison diri, negative ang anti-HBc, negative po ng HBsAg, pero positive ka sa anti-HBs, it means that you are immune because of your vaccination, diba? Because again, ang anti-HBc negative man, you were not infected by the real virus. You did not experience any infection. That's why wala na produce na anti-HBc. But you were immunized, you were exposed to an HBsAg na recombinant or synthetic, you were able to produce anti-HBs, diba? For immunity. That's why you are positive. Okay? Nag-gets lang? Alright. Okay. Alright. Okay. Acutely infected, it could be na sugod pa lang sa infection. Okay? So, muna anti-HBs pa ang nakita. Alright? Or, acutely infected na negative na yung HBsAg, nidecline na siya start, na wala na siya or wala na siya na-detect, gamay na lang na levels, and then anti-HBs na lang ang nakitaan. Okay. Or ang imong anti-HBc po kay gamay na lang po ng concentration or whatever. Yeah, medyo wala ko kasabot na siya acutely infected. Okay. But, sure good na immune because of hepatitis B vaccination. Positive ka anti-HBs, pero negative ka sa HBsAg and anti-HBc. Okay. And for chronic infected, HBsAg is positive and anti-HBc is positive. So, that is chronically infected. Diba? Recall, anti-HBs cannot be produced in chronic infections because of na-fail ang immunity, hindi na siya ka-produce of any other antibodies. So, anti-HBs hindi na siya ma-produce. IgM, anti-HBc, IgM, it's for acute infection. So, of course, mo-decline na siya if chronic negative na yun. But for HBsAg, chronic man, so ang virus na laging sige sa immune system. So, it continuously produces your surface antigen. So, muna mo positive siya. And of course, anti-HBc, diba, it's for lifelong protection. And then, of course, magsigil na po siya be produced because again, it's the first antibody to be produced. So, lifelong persistence niya, increase yung concentration, muna positive. So, therefore, that's why you are chronically infected. So, for chronic infections, positive mong HBsAg and anti-HBc. Total anti-HBc. Total anti-HBc na siya. Okay. So, kanisa tanan, total anti-HBc ang pasabot. Kanang anti-HBc dere, that means total anti-HBc ang i-detect. Ani na panel. Okay? Alright. And lastly, positive rin mo ang total anti-HBc pero negative ang the rest. So, there could be a lot of scenarios. The first one is that recovering ka from acute HBV infection. So, it could mean that, diba, you are still, the first antibody to be released in acute infections or HBV infections is your anti-HBc. So, could be that siya pang positive, okay, kay bago pa lang kang naayo, padulong pa ka maayo, okay, so wala pa yung anti-HBe, dugay pa, di ba? Ang anti-HBc pa na una, di ba? Alright. Number 2 is not sensitive, maybe low level na yung anti-HBs. Okay? So, low levels pa yung anti-HBs because again, kasugod pa lang ka recover. Okay? Number 3 is maybe false positive ang imong anti-HBc and you are actually susceptible, meaning negative yun yung tanan, yung false positive na ng anti-HBc. Okay? And lastly, ang imong HBsAg ang wala na-detect. Maybe low levels pa. But you have HBsAg and that you are actually chronically infected. Okay? So, maybe that low levels pa yung HBsAg or wala siya na-detect, pero you have HBsAg and positive pa siya kag anti-HBC. So, if positive ang HBsAg and anti-HBC, then you are chronically infected. Okay? So, mga scenarios, different interpretations ang possible. And again, you leave that to the doctor, okay, to interpret kung sa'yo ang next buhaton, okay, sa mga results. Alright, okay, so that's for the markers. So I hope na gets na. Okay, very important lang yun. The earliest marker to be released, earliest marker ha, okay, it's HBsAg and indicates active infection. Your HBe antigen indicates high degree of infectivity. Your HBc antigen cannot be detected in serum because of the envelope, dili siya kagawas. Your anti-HBc is your first antibody to be produced. The first antibody to be produced against hepatitis B is anti-HBc, IgM, diba? And IgG anti-HBC will now provide you long-term immunity, okay? And sa total anti-HBc test, diba? Total anti-HBC test, ang i-detect is IgM and IgG, okay? So bahala mo negative na ka sa IgM, pero positive ka sa total anti-HBC, it means that you have IgG. Okay? Kato para sa akong ibutang direct. But if you only perform total anti-HBC in itself, siya na gano'n sa na-test, walay kuyog na IgM anti-HBC, niya positive kag total anti-HBC na siya na usa, mura gano'n mong i-test, dili ka maka-differentiate between IgG ba na or IgM. Because again, it's total anti-HBC na. Siya na makusa imuhang i-test. Okay? Wala man kaya nag-test of IgM ba or IgG na other test na anti-HBC. Na-gets? If total anti-HBC lang in itself, you cannot differentiate between IgM ba or IgG na siya na anti-HBC. Okay? Na-gets lang? Okay. For anti-HBe, it indicates convalescence and recovery. Okay? But siya ang next sa anti-HBC. And then lastly, of course, anti-HBs, long-term immunity then, what we are after in immunization. Okay? And it cannot be produced in chronic infections. Okay? Alright, I hope na gets na. Okay, please take note here. Sa mga markers, malabas sa boards, very important. Okay, alright. Now, for laboratory diagnostic evaluation, what are the tests to perform? So, serological tests for hepatitis B markers, you can use enzyme immunoassays or chemiluminescent immunoassays. And you also have molecular methods using real-time PCR HBV DNA. Your HBV DNA can be detected even 21 days before HBsAg is detected in your serum. That's why ang HBV DNA mas makadetect siya earlier og infection. So mas okay siya to detect earlier infections, to assess mga for screening blood donors, very important, and mga evaluation din og mga lisod interpret, equivocal lisod interpret ng mga HBsAg results. Diba? So very important yun ang molecular methods. Okay? Your HBV DNA can be detected 21 days pa. 21 days even before ma-detect ang HBsAg ma-positive. Diba? So earlier pag kaayo siya than HBsAg, ang HBV DNA through molecular methods. That's why it can be used again for early diagnosis, screening of blood donors, very important. And also to determine mga occupational exposure, like if kita na-expose ba ta, no? If na-expose mo kita sa needle-stick injury, we can perform HBV DNA, okay? RT-PCR, okay? Real-time PCR, sorry. And then also to differentiate or to really interpret mga lisod na mga or confusing na mga HBsAg results, okay? So we perform HBV DNA na test. Okay, and for the testing of HBsAg detection, you have different generations, diba? Okay, so first gen is of course the Octerlony double diffusion. For second generation is counter electrophoresis, rheophoresis, and complement fixation. And the third generation, which is the more sensitive, siya ang pinaka-sensitive sa tulo. Okay, the third generation is the most sensitive among the three. You could use the radioimmunoassay or ELISA, and reverse passive hemagglutination or reverse passive latex agglutination. Okay. Now, rheophoresis, guys, I don't know what's the principle. I think same now with electrophoresis siguro. Pero, as I've read about or research about it, or akong research ang rheophoresis, it's about taking blood from the patient and then taking the blood outside and then kuhaon niya itong plasma that contains all the unnecessary mga proteins. Usually, ginagamit daw siya for mga pangtanggal mga proteins like mga beta molecular something, beta microglobulin, mga ganun. So, I think sa rheophoresis here, kung ng buhaton, tangtama ng plasma sa patient, and then tangtama ng HBsAg, parang ganun, na antigen, and then ibalik na po siya after. So, mara siyang apheresis, okay? I could be wrong, pero wala kayong magawas magod sa serological tests na rheophoresis. But, yeah, this is from my review notes, okay, when I was still reviewing for the board exam. So, ako na siyang include, kaya I did not encounter this in my third year when I was still studying. So, ako na siyang include para at least you're aware. Okay? So, a third generation pa rin ang pinaka-sensitive sa tunog. Alright? Okay. Ayan. So, that's for hepatitis B. Okay. So, daming chika for hepatitis B actually very long. Kaya dagan kayong markers and then lumalabas sa boards and very important din. Okay. Before we proceed to hepatitis D, just a mnemonic on how to remember sa marker, appearance of markers. So, of course, diba, let's say now you are journeying through Earth, okay? And your name is Hep. Diba? Of course. So, you start first with, magbungkal sa kasugod, you start first with the surface, diba? Surface, so that's now your HBsAg. Of course, nagbungkal ka sa surface, so ang next na maabot is of course the Earth itself. Ayan. So that's now your HBe antigen. Okay? Alright, so after sa Earth is of course maabot mo ang core. Okay? But this time sa core, di ba? Wala, di man mo gawa sa antigen, this is now your anti-HBc. Di ba? And then of course, nabot na ka sa core. So, umana ka, mubalik na kapagawas. Mubalik na kapagawas. Imo na pong buhaton is magbutang kag soil sa core para maabot mo ang Earth, which is your anti-HBe. And lastly, pag mabutangan mo ang soil ng Earth, mabutan mo ang surface ulit. Ayan. So, surface, which is now your anti-HBs. Okay, ayan. So, mnemonics on how to remember the appearance of the markers. So, muna yun ang HBsAg, follow your HBe, di ba? And then anti-HBc, anti-HBe, and then finally your anti-HBs. So, magsuot ka sa surface sa Earth, imong bungkalon, ablihan mo. So, mabot ka sa Earth itself, yun. So, HBe. And then finally, padayon ka bungkal, mabuti mo ang core, which is now your anti-HBc. And then, naumana ka sa core, balik na po ka, butanin mo soil ang core until mabuti po ka sa Earth, anti-HBe. And finally, butanin mo soil ang Earth para ma-cover siya yung ibungkal, para mabot ka sa surface, that's anti-HBs. Okay? Alright, so that's a mnemonic that I read. Okay? Alright, I hope it helps them. Alright. Okay, now we go on to the next hepatitis virus, and that is your hepatitis D virus. So for hepatitis D virus, also known as your delta hepatitis, this is considered to be an unclassified virus, incomplete, ayan, defective RNA virus. And that's why ako siyang sunod sa hepatitis B is because kailangan ni ang hepatitis B para siya will live. Wow, how do I live without you? Char, mag-depend lagi. Charot. Kailangan niya ang hepatitis B para maka-replicate siya. And it could cause co-infection or super-infection with HBV. So when I say co-infection, both of them at the same time nakuha sa patient, and both of them cause infection. So at the same time, nagka-hepatitis B and hepatitis D infection ng patient. That's co-infection. Ang super-infection, the patient already has hepatitis B daan, and then in the later part, nakuha niya ang hepatitis D. So, super-infection na siya. Na siya hepatitis B daan, nakuha pa dyan niya ang hepatitis D after some time. Okay? Alright, so that's for co-infection versus super-infection. And the mode of transmission is parenteral or sexual. So, same na siya with hepatitis B. Okay. Alright. Ayan. Signs and symptoms, it could be acute or chronic hepatitis. Okay. So 1 to 3% of the cases progress to a chronic state, and super infections yun ang mas high chance na mo develop into fulminant hepatitis or chronic liver disease, niya accelerated progression towards cirrhosis, liver decompensation, and even cancer. Okay, so super infection. So it can progress to a chronic form and even liver cancer. Okay, alright. So for lab DX, serological is ELISA. We detect HDV antigens and anti-HBV pala na antibodies, the antigens, sorry. And your anti-HBc IgM, which differentiates co-infections from super-infections. I will explain that later. Okay. And molecular is of course PCR to detect HDV RNA, and histopathologic is for liver biopsy to detect the HDV antigen. Aside from HDV antigen, there's also your HBc antigen. It can be detected through liver biopsy. So HDV antigen, and your HBC antigen. These are the two that can be detected through liver biopsy yun, di ba? Kaya HBC antigen, dili siya magawa sa serum, di ba? Alright, okay. Now, how does your anti-HBC IgM differentiates co-infections and super-infections? So let's say super and then co-infection, okay? So, of course, we test both of that, okay? Starting first with your HBsAg, okay? Since both of them are Hepatitis D, di ba, ng mga antigens, and Hepatitis D requires Hepatitis B na infection. So therefore, both of them are positive for that. So it means that na Hepatitis B na infection daan. And of course, next is for the HBV antibodies. Of course, positive po na both because again, both are caused by Hepatitis B. Okay. Next, you then check for anti-HBC IgM. Okay. So for super infection, for super infection, di ba, ang pasabot sa super infection is you already have or the patient already have or has the Hepatitis B daan. So it could mean that dugay na siyang nagka-Hepatitis B, okay? Chronic ba siya? And then later part na nahitabo or nakuha niya ang Hepatitis D. So therefore, IgM anti-HBC is reset. So therefore, sa super infection, negative siya. Okay? Gets? Whereas for co-infection, since co-infection is simultaneous niya, nakuha niya ang duha ka virus daan at the same time, so therefore, ang Hepatitis B infection at a time sa patient is bago pa, reset pa. So therefore, positive ang co-infection with anti-HBC IgM. Gets? Co-infection man, nakuha niya ang duha ka virus at the same time, simultaneously. So therefore, gasugod pa ang Hepatitis B infection niya and ang Hepatitis D infection po gasugod pala. So therefore, ang anti-HBC IgM sa patient is positive sa co-infection. Kaya bago pa man siya. But for super infection, it means that the Hepatitis B has already been there for a long time na, okay, or dugay-dugay na yun. So therefore, your anti-HBC IgM, wala na. Pero ang super infection, positive siya o anti-HBC IgG. Ayan. So sa IgG siya mo positive sa anti-HBC. Okay? Alright. Pero IgM, negative na. But we can differentiate na anti-HBC through anti-HBC IgM. Okay? Alright. Ayan. So opposite ang reaction sa anti-HBC IgG. Positive ang super infection, negative ang co-infection sa IgG. Pero for IgM, negative ang super infection, positive ang co-infection. Okay? Nagets na? I hope nagets ra. Alright, okay. And for the last virus, we have the Hepatitis G virus. The Hepatitis G virus is enveloped single-stranded RNA virus of the Flaviviridae family. So it's 96% identical to a viral agent known as your GB virus type C. And it occurs with co-infections with HCV. Ayan. So kung ang Hepatitis B kay, if ang Hepatitis D kay ganahan siya Hepatitis B, okay, ang Hepatitis G ganahan siya sa Hepatitis C. Ayan. So mga co-infections with Hepatitis C. So they go together, hand in hand, back-winner. Okay. Mode of transmission, blood-borne, parenteral, and sexual. For signs and symptoms, association with hepatitis is uncertain. For lab DX, it's only for research usually. And moleculars, of course, RT-PCR pa rin. Okay, alright. So muna siya for hepatitis G. Usually, hindi kayo siya known to cause hepatitis o pa kayo na established. And it's usually studied for research only. Okay, now here's a table. Alright, here's a table for your different hepatitis viruses. Okay, so hepatitis A is of course picoRNA, viridae, fecal oral, and then the different markers. Low risk again of liver disease, and it does not progress to a chronic state. HBV, all the markers, yes, that we have mentioned. I have to take note the ideas, I forgot to mention. Anti-HBC, total anti-HBC differentiates, okay, natural infection from immunization, diba? Kaya diba sa natural infection, positive ni siya, but for immunization, negative ni siya. Okay? Ang anti-HBS man good, positive sa both. So, dili ka maka-differentiate. Diba? So, ang anti-HBC ang maka-differentiate. Negative siya sa imong immunization, positive sa natural infection. Okay? Please take note. Ayan. Okay, so these are the different markers for hepatitis B. And the next, of course, hepatitis C. Can progress to chronic state? Yes. HCV RNA, monitor effectiveness of therapy, viral load, okay? And HDV, again, increased risk of fulminant hepatitis. Yes, kailangan ng hepatitis B to replicate, co-infection, super-infections. And lastly, for hepatitis E, fulminant liver failure in pregnant women. And it can progress to chronic infections in immunocompromised patients na. Okay, ayun, diba? So, ito na siya for hepatitis E virus. And the summary also of your viruses, hepatitis viruses. And that's also the end of our lecture on hepatitis serology. No? So medyo maraming chika. And I hope na gets lang good. And we're almost done. Yes, kapit lang good. So ang next ani kay salmonella serology. Okay, actually hepatitis, syphilis, and then salmonella. And then miscellaneous topics if kaya pa. So that's all for hepatitis serology. I hope na gets lang good. And I was able to discuss. Sana naman. But again, if you still have any questions or wala mo na sabtan, again, feel free to chika, chat in our GC, ayun na dyan kaulaw, my gosh, okay? And I'll answer as soon as possible, okay? So thank you, dears, for watching, no? Laban lang dira, happy na yun, mahuman, interns na, okay, alright. So thank you again, once again, have a great day and keep safe!